patient comes to us with anything, be it breast or any other general surgery problem, we want them to feel like that they have somebody that's their partner from the day they walk into the office, that will not only identify the problem, be able to help take care of it and to get the people involved that need to, and also see them through whatever it is. And that's really what we've established with this team approach. And it's not just with Mike and Doug and the surgeons, but it's also with the radiation oncologist next door in the Siteman Center, as well as radiation oncologists, medical oncologists at St. Elizabeth's as well. And the breast center radiologist as well as pathologist. It's a team approach, and we've tried to integrate all that in what we do here at Lincoln Surgical. And particularly when you're dealing with a woman who is understandably concerned when they're coming to see us for this problem. Even on more high alert, because none of us have ever personally gone through breast cancer. We cannot know personally what that's like, but we've done this for so long now and talked to so many patients to hear what they have to say. We have an idea of what they really would like to have happen when all this is going on. And not everybody's the same, and we understand that, but we want to give them the opportunity to feel like that we are personally involved in their breast care from day one. For a patient to have the opportunity for potentially 3 surgeon opinions to work together on their case, I think is very appealing. And we enjoy that as well, because then we feel like that we're given the best possible options, best possible treatment, because we're able to work as a team.
There's a surgical portion of the breast care, radiation therapy portion of the breast care, and then chemotherapy and endocrine therapy portion. And so we're able to sit down and take a look at very complicated problems and hear different avenues and different ways to handle these sometimes very difficult issues.
I see Doug almost every time I operate. We're sitting next to each other before and after cases, and we'll talk about cases in gym.
Wednesdays.
On Wednesdays I'll see him, and so I've called you into cases before, and we've watched each other operate. We certainly, I think, we learn from each other things that we don't even realize that we do differently from each other, and it's very valuable information to have. So. Well, I think just excellence in breast care and taking whole care of the patients. We have multiple people involved, multiple physicians involved, people behind the scenes. It's a whole package. It's not just the surgeons you see here. And so as the community grows, there's more need for the services we provide, and just coordination of care with all the other people involved.
So when I look at Mike, I see newer school, and I see somebody who respects and works and does the old school now, but I see somebody that has the intelligence, the skill, and really the vision, I think, to not only continue what we are doing, but to take it to new places, and like we have done for 10 years. And that's our expectation, and I feel very confident that Mike will be able to do that down the road.